Thank you very much. Thank you for being here and online. We produced a report that I think we can all be proud of and that I hope will bring about the changes that improve the lives of our youth. As Bob mentioned, these are the sponsors. While the work of the committee is done and now is officially disbanded with the release of the report, the work of the sponsors will continue in this area. They've all been involved with bullying for a long time, and I hope that this report provides a roadmap to them to continue their work. These are the members of the committee chosen by the National Academy of Medicine. It really was an interdisciplinary group drawing on expertise from individuals around the country. And Bob also mentioned the staff of the committee, and particularly Suzanne, Francis, and Annalie and Kelsey, who did a terrific job assisting the committee in developing this report. As I mentioned, this committee is a very interdisciplinary committee with expertise crossing all the disciplines that really affect bullying, from education to pediatrics to criminology to public health policy, law, mental health. The problem of bullying is one that has been around forever, and I think that we now recognize this to be an important public health problem that we can't simply accept as being there and that children have to live with. Like many other problems, we've come to realize that it has short-term and long-term effects upon children, and a problem that we can actually do something about. The problem has also changed over time, where the traditional bullying in person in the schoolyard or the school cafeteria continues. There's also bullying that occurs online in cyberspace. This whole issue of cyberbullying is a relatively new phenomenon, and we need to recognize that our youth spend much of their free time online or on their cell phones. And this graph simply shows that 71% of kids are on Facebook. Nearly every child is tweeting all day long as well. The statement of task was developed in conjunction with the sponsors, and we use this as our charge for the committee. We were charged with looking at the consequences of bullying, the biological and psychosocial consequences of bullying, and then to look at risk and protective factors that can both prevent bullying and decrease the consequences for those who are involved with bullying behavior. We were asked to tackle 4 specific areas in our report. First of all, the state of the research on neurobiological, mental, and behavioral effects of bullying, to look at what are the characteristics of individuals that affect the dynamic that occurs in a bullying situation, and that affects both the short and long-term outcomes for both the perpetrator of bullying as well as for the target of bullying. We need to look at the physiological and psychological consequences of bullying, not only for the target of bullying, but also for the perpetrator, and incidentally also for the bystanders. And then to look at the factors that contribute to resilient outcomes of the youth exposed to and involved with bullying. The methodology of this report was much like that of all the Academy reports, which is to conduct extensive literature review, and our report is really based upon evidence. We tried to look very hard for the evidence related to bullying. In doing so, we really looked not just at the bullying literature, but at other peer victimization literature, youth violence literature as well. We held 2 public information sessions, one here in Washington, D.C., another in another city in Northeast, to gather information directly from individuals who are trying their best to handle the bullying problem in their community. This included school personnel, community organizations, philanthropy, as well as youth who are themselves targets of bullying behavior. The literature, as I mentioned, was really a very extensive literature review that included studying what has been known about bullying from the peer victimization and harassment literature. Cyberbullying and its relationship to the overall definition was really explored, and the definition of bullying that we used was that was set out by the CDC in 2011. And I think there's 3 important elements of this definition I want to bring your attention to. First of all, bullying is aggressive behavior. Secondly, it is behavior that involves a observed or perceived power imbalance, and it's behavior that occurs multiple times, repeatedly. We, again, use this definition rather than developing our own definition of bullying, because it was developed with a very large committee, and Catherine Bradshaw is one of the individuals involved with that development. We also included in bullying cyberbullying. And cyberbullying shares many of the risk factors and consequences of more traditional bullying, but it is somewhat different because in the online context, there may or may not be power differentials, and it may or may not be repeated over time, but we do know that once it's out there in cyberspace, that it can be disseminated very, very widely. So we did decide to look on cyberbullying as another form of bullying occurring in a different context than traditional bullying, but still under the rubric of bullying. So we'll talk now briefly about the conclusions and recommendations from the report, and they are covered in 4 different areas. One is examining the scope of the problem, the prevalence of bullying overall and among special groups of youth. Secondly, looking at the context that bullying occurs, and particularly the role of stigma and bias. Third, looking at the consequences of bullying, the biological and psychosocial consequences. And then finally, looking at the role of prevention programs and policies. And Catherine Bradshaw will speak next.